I'm Melanie.
And I'm Lila.
And today we're going to be talking about Down syndrome. This is a genetic mutation that affects over 200,000 people in the US alone. Down syndrome is only 1% of the time passed down from a parent to a child. This is a random occurrence that happens in the egg or sperm cell. People with Down syndrome are amazing and can overcome anything. We'll be telling you about how the mutation is caused, the symptoms, if there's a cure to it, and the resilience of the wonderful people who have it.
You might be wondering what causes this genetic mutation. There are two ways that you can have Down syndrome. The technical term is trisomy 21. Now, this is exactly what you think it means. The first part of the word is tri. Another word that starts with tri is tricycle, and it has 3 wheels. Tripod has 3 legs. Tri means 3. So trisomy 21 means that there are 3 copies of the 21st chromosome in a person. With having those extra few chromosomes, you then have Down syndrome. Trisomy 21 is the most common type of Down syndrome. Now, there are 2 other ways you can have Down syndrome. One is translocation and the other one is mosaic Down syndrome. Translocation means that there's the 21st chromosome in each cell, or each cell has a completely extra set of the 21st chromosome. Mosaic Down syndrome is the rarest type. It is where only a few cells in that person have the extra 21st chromosome. It is like a mosaic in a way that is mixing together different types of chromosome sets to make a person. It is just like art. Now, all 3 are caused by mutation in the sperm or egg cell.
You can kind of tell if someone has Down syndrome because of their physical features or by the way that they act. There are tells in the way that someone looks whenever they're born with Down syndrome. There's no difference to the size of the baby, but they do have flatter face features and a bit of a smaller head. People with the disease have smaller necks along with the smaller head, which causes a lot of excess skin to be on the back of their neck. Another identifying feature is in their eyes. They have something called a brush field spots in their eyes, which are small little white or gray spots in their iris. It's due to the aggravation of connective tissue from upward slanting eyes, which most people with Down syndrome have. The spots do no harm to their vision. It's only like a defining characteristic of their eyes. People with Down syndrome may face challenges in their day-to-day life. Most people are more at risk because of mental illnesses because they are mentally challenged. Being mentally ill is like disorders that affect your mood, your thinking, and your behavior. Examples of things are depression, general anxiety, ADHD, OCD, insomnia, and lack of social skills. People with Down syndrome are more at risk for these because they do have a harder time with learning, which means they have to take a little longer to pick up on some things, but with practice they get it. They have a harder time with speech development, which with practice they can get better. And they also have poor muscle tone.
You may be wondering, is the disease treatable or preventable? Down syndrome is not preventable or treatable, but there are some ways you can assist in preventing it and help the people who do have Down syndrome. You can help prevent giving birth to someone with Down syndrome by not having any more kids after you are above the age of 35. 35 and above is kind of a risky time to have kids because they're more likely to have some sort of genetic issue. Other than that, there aren't really any other ways to prevent it. It is almost like a totally random occurrence. People who have Down syndrome can do things that kind of help them live their lives easier for them. When people have Down syndrome and that they're old enough to attend school, they start to attend early treatment programs to help them gain vocal and cognitive skills. Amino acid is a supplement that people with Down syndrome can take that can really help improve their brain activity. It'll give their brain a little boost of energy when they work, and it'll kind of help them focus on what they're doing. One of the biggest things that people use when they have Down syndrome is devices that assist them, like a hearing amplifier, bands, special pencils, touchscreen computers, and larger keyboards. All of these can be used to assist them with school, a job, everyday normal activities. One of the other big things that people with Down syndrome do is that they go to therapy. This helps them live their life to the fullest. They can go to speech, physical, emotional, and occupational therapy. It can just help them fit in with the everyday crowd of people.
There are a lot of people who have done big things, gotten famous for things, even though they do have this genetic mutation. Madeline Stewart was the first professional model to have Down syndrome.
Pablo Pineda was the first European with Down syndrome to receive a university degree.
Tim Harris, won the Special Olympics, met the president, and was the first person with Downs to own a restaurant.
Jamie Brewer is an award-winning actress, and she has won Outstanding Actress in a Play.
That is about all we have for you today.
We hope you learned some new information, and thank you.